We very rarely consider emotional communication when we think about babies and their mothers. Emotional communication refers to a connection between a highly sensitive parent and their child. And for the most part, it is joyful, appropriate, authentic, and positive. And this may be evidenced by a range of behaviors between the mother or the parent and the child. This could include facial expressions, playful touching, what is often known as motherese, which is a comforting, soothing way of communicating with the babies. And these experiences of positive affect regulation is fundamental in laying the building blocks for a child to effectively regulate their emotions. The actual concept of this shared pleasure or shared joy is not often spoken about, yet it is frightfully common. Professor Kaija Purra, who is a professor of infant psychiatry in Tampere University, Finland, was one of the first people to coin the concept of shared pleasure moments. And what this quite simply refers to is the parent and child sharing a positive affect in perfect synchrony. And it sounds complicated, but it's actually fundamentally basic. It is a mother and a baby looking at each other simultaneously with the curving of the mouth to smile and the edges of the eyes in direct gaze contact. It's something that moms and babies do instinctively, and shared pleasure is the goal to which parents and babies strive to indicate sensitivity and authenticity. And the reason we're interested in this is because it's highly malleable. And if you have it, it's great, and your baby is able to regulate emotions and able to express joy. But if you don't have it, and if we recognize that early on, we're able to change that. And the reason we want to change it is because babies are searching for that instinctive connection. And there is nothing more connecting for a baby than a nonverbal smile and a nonverbal gaze. And so there are lots of studies currently that are able to support this internationally in terms of facial affect recognition, which has implications for children who have sensory deficits, who may have issues on the autism spectrum, or sometimes mums who have maternal mental illnesses, who may be depressed, who have blunted affects, who are unable to smile, who are unable to negotiate that authenticity with their children. So, in summary, shared pleasure should be something that all mums instinctively strive for. And sometimes it's the simple concept of looking at your baby when you are talking to them, smiling with, and being able to get some kind of interest and amusement in that connection with your baby.